Hello, everyone. I welcome you to another episode of Your Health Matters. Aminat Adeyemo is my name, and today I'm going to be discussing hemorrhoids, also known as piles. Piles are caused by swollen veins in the anus or the lower rectum. And so that you know, nearly 3 out of 4 adults will have hemorrhoids at one point or the other in their lifetime. So it is very common amongst adults. Hemorrhoids can be external, or if they are inside and you cannot feel it, they can be internal. So we have both external and internal hemorrhoids. So what are the causes of these hemorrhoids? Hemorrhoids can develop from increased pressure in the lower rectum. And this pressure can be due to straining when you are defecating, straining during bowel movements. It can be due to having chronic diarrhea or constipation, or if you are obese. Having anal sexual intercourse can also cause hemorrhoids. And if you eat a low fiber diet, you are prone to having hemorrhoids. If you are also a regular weightlifter, then you might have hemorrhoids. Other risk factors of hemorrhoids, of developing hemorrhoids, are one, an increase in age. So as we get older, so is the risk of having, so we have a higher risk of developing hemorrhoids, because as we get older, tissues that support the veins in our rectum and anus can get weakened and stretch. Another risk factor is pregnancy. So the baby's weight puts pressure on the anal region. So how do you know that you have hemorrhoids? What are the signs and symptoms of hemorrhoids? These actually depend on the type of hemorrhoid. Is it external or is it inside, which is internal? So if it is external hemorrhoids, you might have some kind of itching or irritation in the anal region. There may be pain or discomfort. There may be some kind of swelling around the anus, which you can feel. And most importantly, there may be bleeding. You can see some blood in your feces. If it is internal hemorrhoids, they lie inside the rectum. You can't see them, and most times you can't feel them except with specialized instruments. They rarely cause discomfort too, and they only can cause some straining or irritation when you are passing stool. But if it is internal, there may be some painless bleeding when you are defecating. So you can notice some small amount of blood, of red blood, on the tissue or in your feces when you are passing stool. And this is really important. Do not assume that rectal bleeding is due to hemorrhoids, especially if you have some changes in your bowel habits, or if your stools change in color or consistency. Rectal bleeding can occur with other diseases, other more serious diseases like colorectal or anal cancer. So you have to get checked if you have rectal bleeding. If there is bleeding in your stool, or you can see some bright red blood when you are defecating, please do not ignore it. Get checked. So how do we prevent hemorrhoids? Since hemorrhoids is an household thing, about 75% of people will have hemorrhoids at one point or the other. How can it be prevented? The best way to prevent hemorrhoids is to keep your stool soft, so that when you are passing stool, they can just go easily. They can come out easily from your body. So to do this and to reduce the symptoms of hemorrhoids, you have to eat foods that are high in fiber. These are fresh fruits and vegetables. We can't overemphasize this. They are really important. In fact, they are important for your stools to be soft so that they can pass easily. Secondly, you have to drink plenty of water. Plenty of fluids. Water is more preferable. Aim at drinking minimum of 6 to 8 cups of water in a day. And if water is not really your thing or you are not comfortable drinking water, drink fluids, more fluids, even though water is more recommended, more preferable. Thirdly, do not strain. Do not strain when you are defecating. Straining and holding your breath when trying to pass through will create greater pressure in the veins and the lower rectum, which can lead to hemorrhoids. And lastly, go as soon as you feel the urge to defecate. Your stool can dry out and be harder to pass if you delay defecation. As soon as you feel like you want to defecate, go. I hope you have learned something in this video. I thank you for spending your time and your resources. Don't forget to subscribe to this channel if you have not done so. Until the next time, when I will be talking about hepatitis, you won't want to miss that. Stay safe and healthy, and remember that your health matters. Aminat Adeyemo is my name. Bye now.
Matters.